Welcome back to Trends and Friends. I'm joined by Dr. Beth Nichols, general surgeon and breast cancer specialist with SWAT Surgical Associates. I'm going to get that right. Of course, we're talking about Breast Cancer Awareness Month. We're about halfway through the month, but that's not a reason to forget it. We need to pay attention. It's important. It's something that impacts a ton of people. So talk about why it's so important.
Absolutely. Mammograms and awareness of your health is very important in any month, not just October.
Yes.
Especially if you feel any abnormalities or have any changes in your self-breast exam, it's very important to seek medical attention.
Okay, when it comes to a mammogram, what age do you recommend women going and getting that done?
The American Cancer Society recommends starting at age 40. However, I see so many young ladies with breast problems. If you have a strong family history, then that should take into account. So some ladies are even getting them as early as in the early 30s. So.
Okay, so you just kind of have to pay attention to what your history is and talk to your doctor to figure
Yes.
out when your timeline should be if you have a little bit added risk.
Yes, that is correct.
Okay, now if somebody needed to get a mammogram done, what is the whole process for someone who doesn't know?
Most people need to seek out their primary care physician or a local clinic, and some mammograms, small communities do have buses come out and do free mammograms or at lower costs for people, and you schedule an appointment, get a physical exam, and then get it scheduled.
Wonderful. And talk about the types of treatment options if something were to come about from a mammogram showing cancer.
If you find an abnormality, if the radiologist or the primary care physician notices something different, then they refer them to specialists such as myself, and then we review the mammograms and the reports. We either order further testing or biopsies to further investigate problems.
Okay, and one last question. Of course, when it comes to breast cancer, I feel like everybody thinks of women,
Yes.
but it can impact men as well.
Absolutely. 1% of men, especially in the over 50 age group, can develop a lump in their breast, and they need to definitely take it serious.
Okay, all right. If people wanted to reach out to you, where are you guys located? What are your hours and what's your contact info?
Our hours are Monday through Friday, 8 to 5 at SWAT Surgical Associates, and we are on 3509 22nd Street in Lubbock, and our phone number is 799-7928-SWAT.
Perfect. All the information's on the screen. Definitely something important to remember. You want to be proactive when it comes to this stuff.
Absolutely.
Thank you so much for joining us today.
Okay.
We really appreciate it. And of course, coming up next, we'll learn how to make toys for your dogs that they will love. That's after the break.